Picture this. A man is 68, retired mechanic, still tinkers in the garage every Saturday, still takes his grandkids fishing. He's been on the same blood pressure pill for 9 years. His last checkup, the doctor says, everything looks fine. 6 months later, one lab number tells a very different story. That story is not rare. That story has a name in the published nephrology literature. And today, we're going to walk through it. Honestly, if you're over 60 and you're taking a medication for high blood pressure, a water pill, an ACE inhibitor, an ARB, a beta blocker, anything at all, this next 20 minutes matters. Because the same pill that's protecting your heart can quietly ask a little too much of your kidneys, and the signs show up months before most standard checkups catch them. Here's what I'll walk you through today. 5 signs drawn from published research. What each one means. What to actually ask your doctor. And one number at the very end that almost nobody thinks to request. Let me describe something. See if it sounds familiar. You take your pill in the morning, the way you always have. You feel mostly okay. Maybe a little more tired than a year ago. You chalk it up to age. You walk to the mailbox. You come back. And your ankles look a little puffier than they used to. Not swollen, just thicker. Rings feel snug. Shoes feel tight by evening. Your urine looks a shade darker some mornings. You get up twice at night instead of once. You feel a bit off after a hot afternoon in the garden and you're not sure why. None of these things on their own mean anything is wrong. That's the honest truth. It's completely reasonable to shrug and say, well, this is just what 68 feels like. Most people over 60 do exactly that. But here's what current nephrology research keeps pointing to. The kidneys are quiet. They don't complain the way a knee complains or the way a stomach complains. They lose function slowly and often silently. And blood pressure medication, which most cardiologists agree is one of the most important tools we have for protecting the heart and brain, asks the kidneys to work in a very particular way. Picture someone in their late 60s, retired school teacher, still walks a mile before breakfast, still hosts the grandkids on Sundays. She's been on a diuretic and an ACE inhibitor for 12 years. Her blood pressure numbers look beautiful on paper, and her kidney function has been quietly drifting for the last 3 years, and nobody flagged it because the drift stayed just inside the normal range for her age. This is a composite of common cases you'll find written up in general practice journals. But it's the exact pattern researchers describe. I'm Dr. Aliza Wright. On this channel, I don't treat patients. I review published research on senior health. The kind of explanation a 15-minute appointment doesn't have time to give you. Before we go any further, I want to ask you 2 things. Drop them in the comments below. Your age and the city or state you're watching from. That's it. I read every comment on this channel, and it genuinely changes how I record these videos. Take 5 seconds, drop it below. I'll wait. Now, one more thing before we get into the 5 signs. This video is educational. It is not a diagnosis. Nothing here replaces a conversation with your own doctor who knows your history, your medications, and your labs. If anything I described today rings a bell, the next step isn't to change a pill. It's to ask a question, write it down, bring it in. Okay, let's get into it. To understand why blood pressure medication can strain the kidneys, you need to understand what the kidneys actually do. And I want to keep this simple because most explanations aren't. Think of your kidneys like 2 coffee filters. Every minute of every day, they filter your blood. They pull out waste, extra salt, extra water. They send the good stuff back into circulation, and they hand the waste off to your bladder. For those filters to work, they need pressure, not too much, not too little. Just steady, gentle pressure pushing blood through them. Kind of like the water pressure in your kitchen faucet. Too weak and nothing comes out. Too strong and you damage the pipes. Now, high blood pressure over years damages those filters. That's why treating it matters. That's why doctors are so careful about it. According to guidance from the American Heart Association updated in recent years, keeping blood pressure controlled is one of the single most protective things you can do for both your heart and your kidneys. But here's the wrinkle. The medications that lower blood pressure also lower the pressure inside the filters themselves. And in older adults whose kidneys are already working with less reserve, that drop in filter pressure can, sometimes, tip the balance the other way. A 2020 review published in the Journal of the American Society of Nephrology described this exact tension. Blood pressure medication protects the kidney from the damage of high pressure. And in some patients, especially older ones, the same medication reduces the filtering pressure just enough to slow the kidney down. Both things are true. At the same time, this is why the sign of trouble isn't the blood pressure number. It's what's happening one layer below. Let me name the medication classes we're talking about briefly so you can look at your own bottle later. Diuretics, water pills. Names like hydrochlorothiazide, furosemide, chlorthalidone, ACE inhibitors. Names ending in pril. Lisinopril, enalapril, ramipril. ARBs. Names ending in sartan. Losartan, valsartan, olmesartan. Beta blockers. Names ending in olol, metoprolol, atenolol, carvedilol. Calcium channel blockers, amlodipine, diltiazem, others. All of these are widely used, well-studied, and for millions of people doing exactly what they should. This isn't a video telling you they're dangerous. This is a video telling you what to watch for, so you and your doctor can catch a shift early. Okay, 5 signs. Let's go through them. Sign number 1. Ankle and leg swelling that shows up in the afternoon and eases overnight. Here's why this matters. When kidneys start holding on to extra fluid, gravity pulls that fluid down. So it collects around the ankles, the feet, sometimes the lower calves. Mornings look normal, evenings look puffy, rings feel tight, socks leave a deeper mark than they used to. Now, swelling can come from 100 other things. Long car rides, hot weather, a salty dinner. That's why one puffy evening isn't a story. It's the pattern that matters. Most days, most evenings, for several weeks. What to ask your doctor. I've noticed my ankles are more swollen in the evenings. Can we check my kidney function and my sodium level at my next lab draw? That's the sentence. Write it down. Sign number 2, urinating less or urinating a lot more than what's normal for you. The kidneys handle water. When they're stressed, that handling gets uneven. Some people notice they're going less often and the color is darker. Others notice the opposite, waking up 2 or 3 times at night to urinate when they used to sleep through. Either direction is a signal, not an emergency, a signal. Picture someone in their early 70s, retired accountant, still does the crossword every morning in pen. He notices over about 2 months that he's up 3 times a night. When he used to sleep straight through until 5:30, he mentions it to his doctor almost as a joke. His doctor orders a basic metabolic panel, and that panel catches something the yearly physical had missed. That is exactly the kind of small conversation that changes a health trajectory. And it costs you nothing but a sentence. Sign number 3, muscle cramps, especially at night. That don't respond to the usual fixes. This is the one that surprises people, because most of us hear muscle cramp and think about hydration or magnesium, and sometimes it is that. But diuretics in particular can pull potassium and other minerals out of your body faster than food can replace them. Low potassium shows up in the calves, in the feet, in the arch under your foot. Charlie horses that wake you up. According to background information published by the National Kidney Foundation, potassium is one of the minerals most tightly regulated by the kidneys, and it can shift meaningfully in people taking diuretics. Which is why routine blood work for anyone on a water pill usually includes a potassium check. What to ask your doctor. I've been getting leg cramps at night. When was my last potassium level checked? 1 sentence. That's all. Now here's a small aside I want to fold in because it applies to almost everyone watching this. If you have a family member on blood pressure medication, a spouse, a parent, a sibling, this video is worth 60 seconds of their time. Just send it, because these 5 signs get missed most in the people who are least likely to complain about them. Sign number 4. Unusual fatigue that shows up in the afternoon and doesn't lift with rest. Kidneys do more than filter waste. They also help the body make a hormone called erythropoietin. That hormone tells your bone marrow to make red blood cells. When kidney function slips, that signal weakens. Fewer red blood cells. Less oxygen carried through the body. And the feeling is a heaviness. A slow, wrung-out tiredness. Different from sleepy. Different from bored. Research summarized by the National Institute of Diabetes and Digestive and Kidney Diseases describes anemia as one of the common companions of reduced kidney function in older adults. And it often shows up before pain does, before swelling does, before anything else does. The confusing part is that fatigue at 65, 70, 75 has 100 possible causes. Poor sleep, low iron, thyroid changes, depression, grief, medication side effects. So this sign by itself doesn't prove anything. It joins the list. What to ask your doctor. I've been more tired than usual for the last few weeks. Could we check a complete blood count and a kidney panel together? Sign number 5. And this is the one almost nobody's talking about, foamy urine, or urine that looks bubbly, dye, and the bubbles don't clear. Here's what that can mean. Healthy kidneys keep protein inside the bloodstream, where it belongs. When the filtering apparatus is strained, small amounts of protein can leak into the urine. Enough protein makes the urine foam. Enough foam that lingers is worth mentioning. The medical term for this is proteinuria. It doesn't hurt. It doesn't burn. It doesn't smell different. It just looks different. And most people, understandably, ignore it. Or don't notice at all, because most of us don't spend much time looking. According to information published by the National Kidney Foundation, a simple urine test can measure protein levels precisely. It's inexpensive. It's fast. And it's the kind of test that gives you and your doctor a very early read on how the kidney filters are handling their job. What to ask your doctor? I'd like to know my urine albumin to creatinine ratio. Can we add that to my next lab work? Write down the phrase, urine albumin to creatinine ratio. That's the number. That's the one almost nobody thinks to request. And here's a small extra layer that's worth knowing. There's also a blood test called estimated glomerular filtration rate, usually written as eGFR. Most doctors order it as part of a basic metabolic panel, but the eGFR only tells part of the story. Pairing eGFR with the urine albumin to creatinine ratio gives a much fuller picture. Guidance from the National Kidney Foundation has emphasized this combination for years. Okay, take a breath. That's the 5 signs. Now I want to answer the question I know is sitting in your head. If my blood pressure medication might be doing this, should I stop taking it? Here's the honest answer. No. Not on your own. Not without a conversation. Stopping a blood pressure medication suddenly can cause your blood pressure to spike back up, sometimes higher than before. That spike carries its own risks for the heart, for the brain, for the very kidneys we've been talking about. The goal of this video, is not to move you away from medication. It's to help you have a smarter conversation about the medication you're already on. Most cardiologists and nephrologists agree on this. The safest path is regular monitoring and adjustment when the numbers ask for it, not sudden change. Let me name the sources one more time, because you deserve to know where this comes from. The American Heart Association publishes ongoing guidance on blood pressure management. The National Kidney Foundation publishes patient-facing and clinician-facing guidance on kidney testing and monitoring. The National Institute of Diabetes and Digestive and Kidney Diseases, part of the NIH, publishes research summaries on kidney disease progression and its links to anemia and cardiovascular medication. And peer-reviewed journals like the Journal of the American Society of Nephrology publish the underlying studies. None of these bodies are telling anyone to stop their medication. What they are saying consistently is that kidney function in older adults on antihypertensive therapy deserves regular, structured monitoring. That's the message. Now, there are situations where a phone call to your doctor should happen today, not next week, today. If your urine output drops dramatically over a day or two and stays low. If you notice sudden, significant swelling in your legs or your face, especially with shortness of breath. If you feel confused or unusually weak in a way that's new for you. If you've fainted or come close, or if you've missed several doses of your medication and aren't sure how to restart safely. These aren't things a video can guide you through. They need direct evaluation. Please call your doctor's office or the nurse line on the back of your insurance card. That's what they're there for. Let me run through the core points quickly. 1. Blood pressure medication, for most people, protects the kidneys by controlling the pressure that damages them over years. That's the primary story. 2. In some older adults, the same medications can also lower the pressure inside the kidney filters just enough to slow function down. Both things can be true in the same person at the same time. 3. 5 signs are worth watching. Ankle swelling in the evenings. Changes in how often you urinate. Muscle cramps, especially at night. Unusual afternoon fatigue that doesn't lift. And foamy urine that doesn't clear. 4. 2 tests give you and your doctor a much fuller picture than either one alone. The eGFR from a basic metabolic panel and the urine albumin to creatinine ratio. 5. The action step is never to stop a medication on your own. The action step is a specific question at your next appointment or sooner if the signs feel steady. Here's the whole message in one sentence. Your kidneys speak quietly, and knowing what to listen for is how you and your doctor stay ahead of the changes together. Now, before I let you go, there's one thing I haven't told you yet, and it's actually the reason next week's video matters, because the same class of medication that can strain the kidneys in some people has a completely different relationship with the thyroid. And that connection is one most patients have never heard about. That's what we're covering next week. If this helped you see something new, subscribe. It's the single thing that tells the algorithm to keep bringing these to people who might need them. And in the comments, I'd love to hear, which of the 5 signs surprised you the most? I read every one. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.